I'm Melissa Mancini with Canadian HR Reporter TV. I recently sat down with Jeff Linkenbach from the Center for Health and Safety Culture at Montana State University to talk about how changing misconceptions can improve health and safety.
We're talking about some innovative approaches for reducing motor vehicle incidents across the province. So Ontario has some of the safest roads in North America, and they can be safer. On the work site, we know that the culture and the norms really have an impact. What other people around us are doing impacts us. Well, the same thing happens in terms of driving vehicles. If I think that and understand that most of my colleagues are indeed wearing their seat belts and adhering to the speed limits and other regulations, I'm much more inclined to do that myself. So the challenge is, how do we change these perceptions? And the answer is that we can use data and feed that data back into the population.
How does that work?
So what we'll look at doing is collecting data on people's actual norms, meaning their actual attitudes and behavior, and then the real hot button is we also collect data on what we perceive to be the norms of others. What we find is there's often a gap between what I report I'm doing myself and what I think most other people are doing. We know in health and safety, whenever there's a gap, there's an opportunity. And so in this case, there's a gap between actual norms and perceived norms. And if we can close that gap, we can see changes in behavior.
Can you give me an example?
So one example is that in my state, in the state of Montana, we identified a gap related to drinking and driving. In particular, we were looking at young adults, which were the high-risk group for this behavior. And we found that most young adults in Montana were not drinking and driving. However, they thought the exact opposite. They thought there was much higher prevalence of drinking and driving than really was the case. So we were able to set up an experiment in the western half of the state and deliver media messages to close and correct that gap. In doing so, after a 1.5-year intervention, we measured a 14% reduction in drinking and driving in that population.